Hello, my name is Professor Alison McMillan and I'm the Australian Government's Chief Nursing and Midwifery Officer. This Sunday is the World Health Organisation's Cervical Cancer Elimination Day of Action. And in honour of this, I'd like to answer some questions we often get asked about cervical cancer and how doing a 5-yearly cervical screening test can prevent it. So how does cervical cancer develop? Almost all cervical cancers are caused by the human papillomavirus or HPV. HPV can be passed through sexual contact, including with people of the same sex. And HPV is very common. There are more than 100 types of HPV, and more than 80% of sexually active people will be infected with it at some point in their lives. While most cases of HPV clear up on their own, in some cases it can stay in your system for a very long time. It can even lie dormant and reactivate later in life. HPV can change the cells in your cervix over time. If left untreated, these abnormal cells can develop into cancer cells. HPV-related early cell changes rarely show any symptoms, which is why routine cervical screening tests are so important. Even if you've had the HPV vaccine, you still need to do cervical screening. And while the HPV vaccine protects against many forms of HPV that can cause cancer, it doesn't cover them all. Now, you may remember the Pap smear. The Pap smear took a sample of cells from your cervix to look for unusual changes to cells or cancer. While Australia stopped using the Pap smear in 2017 and moved to the more accurate cervical screening test. Cervical screening test detects HPV before it even has had chance to change into cervical cancer. So how do you get a cervical screening test? You can get a cervical screening test at most health practices and clinics, such as a GP or a community health centre. You can also do screening with a gynecologist or a nurse who's been trained in cervical screening. There are 2 options on how the test is done, and both are organised through your healthcare provider. The first option is a clinician-collected test. A doctor or nurse will use a speculum to reach your cervix and take a sample of the cells for HPV and abnormal cell testing. The second option is for you to do your own test using a simple swab. This test can be done at a health practice or clinic. This involves a self-collection swab which is inserted a few centimetres into the vagina, rotated to collect samples for HPV testing. So when booking your appointment, tell your health practice or clinic if you'd like to do the test yourself, as they may need to order some swabs. So how do you know when you're due for a cervical screening test? So when you turn 25, the National Cervical Screening Programme will send you a letter inviting you to have your first cervical screening test. Once you do your first test, you'll be added to the National Cancer Screening Register. Then the register records your tests and sends you reminders when you're next due to screen. For women and people with a cervix aged between 25 and 74 who've had sexual contact should do a cervical screening test every 5 years. Now, you will be eligible for the Medicare rebated test from 4 years and 9 months since your last test. You can check your due date via MyGov's National Screening Register patient portal. You can also contact your healthcare provider to find out when you're due to screen. If you're due or overdue, make sure you book an appointment today. It could save your life. For more information, visit health.gov.au/NCSP. And thank you for watching.